Excessive alcohol can affect liver function and therefore indirectly have secondary consequences on the anesthetic agent.
How soon can people have that cigarette or have that vape?
Never.
It's a good advice.
Alcohol is one of those things, everyone's tried to find sort of loopholes in alcohol. Going through the red wine may have some homeopathic things in it that are good for you. So similarly, I don't think alcohol is ever good for you, but I don't think if you're having the odd glass of wine, it's going to necessarily significantly impact your surgical outcomes, not only from a health perspective and not only from a healing perspective, but just a quality of life, healthy living, the way people look. It's evident who smokes and who doesn't smoke.
Okay, last one, Ozempic.
The American Society of Anesthesiology came out with recommendations indicating to avoid Ozempic for about a month before having an anesthetic for elective surgery. Rhinoplasty procedures is less that you can really tamper with.
Have dirty fingers with that.
I'm not saying you can have dirty fingers, but we don't want patients picking at their nose or anything after surgery. Hi, everyone. It's Dr. Solomon. I want to welcome you back to another episode of Unfiltered. Today, we're going to be having a question and answer period. Nancy's going to be giving me a number of questions to highlight the importance of pre-care and post-care relating to surgery.
Hi, everyone. So I thought this would be a good topic for us to chat about because we often bring patients on the podcast and we talk about their recovery and most people say it was fairly smooth. So we want to talk about how to optimize your recovery. So what to do prior to surgery, to prep for surgery, to optimize a good recovery, and what to avoid and how to recover in the best possible fashion. So, Dr. Solomon, how important is prepping for surgery? Avoiding things like smoking, avoiding drinking, avoiding certain supplements. How important is that?
It's critical to the surgical outcome. So especially smoking and avoiding certain medications that can make you bleed. You can take a beautiful operation and ruin it if you basically don't follow some of these instructions. It also depends on which operation you're talking about. So let's talk about facelifts for a minute. Smoking, if you continue to smoke and don't tell your surgeon, whether it's vaping or smoking cigarettes or pot, and you're doing it before surgery or after surgery, it can significantly affect the flap survival of a facelift. Commonest area that a facelift will fail in terms of its healing is behind the ear. So the area back here behind the ear, extending down towards the hairline, is an area where the blood flow, it's called the watershed area, but the most compromised blood to the entire face is in that area from a facelift operation because the way the incisions are designed and the distance the tip of this flap is away from where the heart and where the blood is coming from allows that area not to get optimal blood supply and potentially could be under some hypoxia or lack of oxygen to the area, which can affect wound healing. So sometimes during surgery, everything looks great. And then we always look behind the ear during the healing process, and sometimes the flap will look dusky. So to avoid, if a patient has a dusky flap, we'll get into that. There's other things that we can do to improve the healing, but more often than not, it's either due to two things. One is the patient is smoking or the surgery compromised the blood vessels to the flap by going too superficial or traumatizing the tissue too aggressively, maybe a revision operation and maybe in a lot of scar tissue, or the patient's blood flow and blood supply is not great, or it's been compromised by too much tension or cigarette smoking.
Okay, now I've also heard you mention that if somebody is smoking within 4 weeks of surgery, it makes for a bloodier surgery, hard for you to see.
I wouldn't say that cigarette smoking contributes to bleeding, but I do think that patients who are heavy smokers may not have as healthy tissue to work with, and it's sometimes evident in facelift surgery in general. But I wouldn't say that it affects bleeding so much, but there are many other things that can affect bleeding. So homeopathic medication, vitamins, herbs, supplements, certain foods like garlic, vitamin E.
So when you say garlic, do you mean like pure garlic?
Like pure garlic,
Yeah, because people often ask, when they see our list of supplements to avoid, they say, garlic, do I really have to, can I eat it still? So what's your recommendation? Let's get specific. For smoking, smoking.
No smoking at all.
For 4 weeks?
Well, as long as possible before, but minimum probably 2 to 3 weeks before and 2 to 3 weeks after.
Absolutely no smoking, no vaping,
smoking.
no pot.
Yes.
Okay.
I'm not as concerned if a patient's taking gummies. I mean, that may have its own secondary issues relating to the anesthetic and the way that the patient tolerates anesthesia. But in terms of the way people heal, that's probably less of a factor. But the cigarette smoking, the nicotine puts the blood vessels into a spasm, and the spasm is what can compromise the healing.
So that means you can't wear that little patch that people are now putting in their mouths, no patch on your arm, so nothing, no nicotine. It's about the nicotine.
Correct.
Okay. Supplements. So we were talking about garlic, and there's other supplements that we recommend. Ginkgo. What else do we suggest that people avoid?
It's anything that's got fish oils,
Right.
vitamin E, the garlic we mentioned, anti-inflammatory medications such as aspirin, Motrin,
Yeah.
Advil.
HRT. That's a whole topic. We'll get to that in a second.
Yeah, so all of these things need to be just followed relatively rigorously because they can all compromise the surgeries. You don't have a good operation and a bad outcome due to something that could have been avoidable.
Okay. So the reason we avoid these supplements is because they can increase bleeding. Is that right?
Correct.
Okay. So that's really important because that could affect not only the surgery, how would that affect the recovery?
So if intraoperatively a surgeon encounters lots of bleeding, it's harder to see, which means the operation may not be as smooth, may be slower, it may require more cauterization to control the bleeding, which can also affect the tissues, the flaps, the healing, and the recovery. If a patient develops what's known as something known as a hematoma, which means there's excessive bleeding, they can get an accumulation of blood under the skin, which can compromise the healing in the flaps as well, specifically with facelifts. With regards to rhinoplasty procedures, if a patient bleeds a lot, it may just be difficult to see. There may be excessive swelling. The healing can be compromised, and they may have severe nosebleeds after surgery, which can necessitate nasal packing.
Okay. And what about hormone replacement therapy? A lot of our facelift patients come to us and they're on hormone replacement therapy. What is our guideline? Now, our guideline may not be all surgeons' guidelines, but for whatever reason, you can tell us what your reason is that you've adapted certain protocols.
Yeah, hormone replacement therapy is a little bit trickier. I don't think it's as clear cut as some of the other things we've talked about. But with hormone replacement therapy, if a patient's on it, like birth control pill, or if a patient's on it who's transgender, or if someone's on it because they're post or perimenopausal, the issues relating to it is the effect it can contribute to blood clots in your legs. So when you go on an airplane, for instance, you can get a blood clot in your leg. If you're lying still for an operation that's extended period of time, you can get a clot in your legs. So hormone replacement therapy of any kind can potentially put you at risk of getting a clot. So we use pneumatic compressive devices, things to prevent it happening. But we also think it's probably safer if patients go off of it just before surgery as well, to avoid the potential chance of developing a blood clot in the leg.
Okay. And now alcohol. We tell patients basically 2 weeks, no alcohol. Then they come to us and say, oh, it's my birthday a week before surgery. Can I have a drink? And you're usually pretty good about that. You'll say, yeah, have a drink, don't go crazy. So why do we avoid alcohol 2 weeks before surgery? And why is it okay to at least have one and it doesn't impact the surgery?
Alcohol is one of those things that, we don't necessarily think of it as an absolute contraindication to drinking before surgery in terms of the way it's going to affect bleeding or that it's going to affect wound healing. But excessive alcohol can affect liver function and therefore indirectly have secondary consequences on the anesthetic agent. We find patients who drink a lot of alcohol may find that the anesthetic doesn't seem to be working as well on them. So they may be moving or waking up during the operation. Their blood pressure as a result may spike, which can then contribute to bleeding. So there's sort of a cascade that can be put into motion due to the fact that they've been drinking, and potentially the anesthetic may be more tricky to maintain. So it's sort of an anesthetic issue, which can lead to physiologic changes, which can lead to surgical changes.
Good to know. Okay, last one, Ozempic.
Ozempic's one of those things that came out like as a very popular medication, for weight loss in the last few years. Its indications have broadened from diabetes to weight loss. And it was identified that it can affect gastric emptying, which is your stomach's ability to empty into your intestines. If you have prolonged gastric emptying, it means you have like food or fluids still in your stomach. There's an increased chance of vomiting during anesthetic. There were a couple of cases in the United States where there was a presumption that someone who was on Ozempic vomited and then aspirated, which means some of the food went down into her lungs, which led to a bad surgical outcome. I don't know if there was even a death related to it. And so the American Society of Anesthesiology came out with recommendations indicating to avoid Ozempic for about a month before having an anesthetic for elective surgery. Those indications have changed and have become shorter and shorter. We typically in our clinic recommend patients go off Ozempic about 2 weeks prior to surgery.
Okay, so now we've discussed prepping for surgery. Let's talk about following post-care instructions after surgery. Some people may think, how important is this? How soon can I start smoking? When can I start drinking? I want to get back to my life. So let's talk about the recovery and how important some of our post-care instructions are, and do they really affect the surgical outcome if they are not followed? So I'm going to sort of go through the list again. So smoking, how soon can people have that cigarette or have that vape?
Never.
It's a good advice. Good advice.
I think smoking is the one potential thing that if you can take the opportunity of having an operation and quitting smoking due to the fact that you're stopping for a few weeks, you should embrace that and try to go down that path of just, stopping smoking for good. So I can't really give an advice and saying, yeah, it's good to start smoking at a certain time because it's never good to smoke. And it's the one thing that we see not only from a health perspective and not only from a healing perspective, but just a quality of life, healthy living, the way people look. It's evident who smokes and who doesn't smoke. You can tell the skin quality looks duskier. They look more, they age at an accelerated rate. There's all sorts of things, but skin quality primarily is affected by smoking. I'm not talking about smoking a little bit. I'm talking about like the odd cigarette. I'm talking about people who regularly smoke. So smoking, try to cut it out of your lifestyle. Similarly, vaping can contribute to all sorts of diseases. Popcorn lung is the one that people have known about for a while, but I think it has probably an accelerated aging process as a result of vaping. It's bad for your lungs, bad for your heart, bad for your beauty. So vaping.
And alcohol, how soon after surgery can you start to drink?
Alcohol is one of those things, everyone's tried to find sort of loopholes in alcohol. Going through the red wine may have some homeopathic things in it that are good for you. So similarly, I don't think alcohol is ever good for you, but I don't think if you're having the odd glass of wine, it's going to necessarily significantly impact your surgical outcome. So I'm not as obsessed with having a glass here and there of wine. The problem is that most people who drink socially with their meals probably have more alcohol consumption than they're even aware of. And it's a cumulative effect that's been linked to certain cancers impacts your overall general health. So keep it to moderation. The best is to not drink anything, obviously.
Okay, let's talk about some other aspects of post-care. So we recommend patients sleep elevated slightly. Usually we say 2 or 3 pillows just for height-wise. What's the reason we suggest that, and what are the benefits?
Well, primarily we're doing facial plastic surgery. So by having your head higher than your heart during the nighttime, it's facilitating blood flow down and drainage. A lot of the patients you'll see that have some early signs of bruising around their eyes from rhinoplasty or in their cheek areas from a facelift, you'll start seeing some discoloration and bruising going down. Sometimes it even tracks down to the chest. So we want to move all the swelling away from the surgical site so it just gets absorbed by your lymphatics and into your own circulation. And, to speed that up, having your head elevated at nighttime rather than lying flat seems to facilitate the healing process and reduce the swelling around the face. We have some people who come in and they've lay flat right after facelift surgery, and they just look way puffier.
And then we have patients who rent lazy boy chairs. There are people who do that for facelift surgery. So that's a little bit more extreme. So what would you say is really ideal? So for 1 week, sleep elevated, for 2 weeks?
Yeah, 1 to 2
depending
weeks,
on the surgery.
I think is a general guideline. I think that patients then can sort of see how they feel. I mean, it's sometimes difficult. We don't want you to lose sleep because you're uncomfortable. But ideally, if you can have some elevation, it's helpful.
Yeah.
So again, it's sort of a recommendation. We're not fixated on it. It's not going to have a significant impact on the surgical outcome, but it may speed up the recovery.
Right. So that's the fine line, because people want to be comfortable, they want a speedy recovery, and they want it to look good. So those are all the things that everyone's kind of juggling. We talk about exercise. We suggest to patients 4 weeks for strenuous exercise, no heavy lifting. How important is this, and how would this affect the recovery if they start a little bit sooner?
I mean, these are guidelines, recommendations. They're not absolute. So some people who are like professional athletes or people who really need to maintain themselves, or they'll go insane if they're not doing any physical activity. Sometimes we say take 2 weeks off, do very little, then start with non-impact type of exercise, elliptical, walking, light weights, things like that. They can probably start around 2 to 3 weeks. Heavy lifting and things like that, or rigorous exercise, or jumping, you just may get more swelling, and you may get from rhinoplasty, you may get a nosebleed. From blepharoplasty or facelift surgery, you may have persistent, prolonged edema and swelling if you're too active.
But it shouldn't impact the result, or it could
I don't
impact
think
the
it'll
result?
impact the result. But again, if you started
Just
right away,
delays
it
healing.
could, but it'll just delay healing or make you a bit more puffy.
How important is eating well?
I think healthy eating in general is obviously important. I think having good nutrition, good protein intake, healthy nutrition, vitamins, and so on, they're only going to facilitate the healing process. But I can't say that I have like an exact diet that we give out or recommend. We just basically recommend a fulsome, healthy, balanced diet.
Makes sense. Okay, next one.
I don't know if that was the right answer.
It was a good answer. Something people may not always think about or be conscious about are clean hands. It's so important to manage your incisions, your wounds with clean hands, because these fingers can have bacteria on them and they can cause an infection, which can complicate your healing quite significantly. We've seen that with facelift patients who may not have managed their wounds carefully. Correct. Clean hands are pretty important.
Yeah, in general, obviously, we assume that patients are following normal hand hygiene, that they're keeping their hands clean. I mean, they're the patient, but they're also the caregiver of their own wounds after the surgery is done. Specifically, bigger operations such as facial feminization procedures or facelifts. Rhinoplasty procedures, there's less that you can really tamper with.
Have dirty fingers with that.
I'm not saying you can have dirty fingers, but we don't want patients picking at their nose or anything after surgery. We give sort of a protocol post-rhinoplasty specifically. Humidifiers, nasal lubricants, ice packs, cold compresses, saline sprays, but we don't have patients picking at their nose, because obviously that could damage the results from the rhinoplasty or introduce bacteria. With regards to facelifts or specifically laser resurfacing patients or combination procedures, the patients have to be following a very specific post-laser protocol. Where we're actively advising them on what to do, but we're relying on them to do it because it can impact the outcome.
Okay, now we're going to talk a little bit about heat, saunas, hot tubs, going out in the sun. How does that, like we suggest, wait a good 4 to 6 weeks until you're doing all of that. But is there a negative side to doing any of that from that point on or even prior?
Well, saunas and hot tubs and outdoor sun's all different topics. So solar radiation is going to potentially affect the wound healing. You don't want to get a suntan afterwards. It can cause dyschromias, discoloration, can affect the scar. So you're trying to stay out of the sun. So big hats, sunscreen, we start to implement a few weeks after the operation, especially patients who've had laser resurfacing, their skin's going to be sensitive to the sun. Rhinoplasty, less of a concern with some of those issues. We don't want them tanning because their nose may be sensitive to the sun. Also, they may not be as aware if they're getting a burn. And again, so a hat and
some numbness, you're saying, at the tip.
Yeah, they may just not be aware as much if they're outdoors and getting a tan. And their skin may be sensitive a little bit because it's been lifted up off the bony and cartilage skeleton and put back down. Saunas, I don't really have like a fixed recommendation on saunas. Usually after the first month or so, people are good to go. Good to go into and probably infrared sauna maybe has some advantages too.
I was going to say, what about red light?
Red light, we're proponents of
I'm going to talk about all
infrared saunas
that.
are okay, but hot tubs, jacuzzis, and things like that probably there's chlorinated water and potentially can be a risk. You're going to get an infection if you go too soon. So, a few weeks later, you should be mostly healed. But I usually tell people stay away from, jacuzzis for a few months.
So the last component I wanted to discuss was we live in a very impatient society. Everybody wants things yesterday. So patients often say the next day after surgery or even a week after surgery, I'm still swollen. What can I do? And it's like, you're only 1 week post-op and it can take months. So everyone wants things fast. So what are the the little tricks that we share with patients on how they can sort of expedite the healing, maybe not the healing as much as reduce swelling. So we recommend arnica supplements, bromelain, pineapple juice, oxygen therapy, maybe red light therapy.
Yeah, I mean, all those are important. If you're doing, I find when patients are doing all of them, they seem to heal the quickest. So it's probably like 1+1+1 equals like 10 kind of thing. So they're doing, especially after facelift surgery, almost all our patients, we advise them to get hyperbaric oxygen. I think you would agree that you see some of them heal much quicker than others.
For sure.
Red light therapy, if they're doing it, that's great. If they're eating healthy and taking bromelain and some supplements and arnica, great. But when they're doing it all together, it
makes
seems to
a
help
huge
the
difference.
most. The other thing that we're starting to implement more with our facelift patients, some people are getting I can't speak at the end of the day, but post-facelift lymphatic massage. And I find that sometimes can be implemented if done by a good care provider who has experience with facelifts that works collaboratively with us. They can help reduce some of the bruising and swelling and speed up and facilitate some of the healing.
Good tips.
So thanks for taking the time to listen to another episode of Unfiltered. We hope that today's episode was informative, helpful for our own surgical patients or those who are having surgery elsewhere. We welcome feedback, and we will be back with some more information to share with you guys shortly.